Hi, welcome to Pathology Riddles. In the last class, we learned about what is obesity, classification of obesity, how to measure if the person is overweight, and mechanism of obesity. In today's class, we will learn about what are the diseases which are caused by obesity and how does obesity contribute to causing of those diseases. First, let's list out the diseases which obesity contributes to. We have metabolic syndrome, type 2 diabetes mellitus, hypertension, coronary artery disease, non-alcoholic fatty liver disease, cholelithiasis, hypoventilation syndrome, osteoarthritis, and cancer. It is important to know that out of two types of obesity, central type is the risk factor for many diseases. The disease that it commonly causes is metabolic syndrome. What is metabolic syndrome? It is a group of abnormalities characterized by alteration in glucose metabolism. Then there is alteration in lipid metabolism. Then there is hypertension. And then there is a pro-inflammatory state. So why does this occur? Because the free fatty acids and lipids which are stored in the cells and tissues activate the inflammasome response. I hope you remember inflammasome. It is basically a group of protein activated in response to cellular damage inside the cytosol. So once it is activated, it will secrete interleukin 1. This will cause insulin resistance. In order to compensate, there will be increased insulin production. So it will lead to hyperinsulinemia. What happens when there is insulin resistance? In this, skeletal muscle, adipose tissue, and liver's response to insulin is decreased. So there is failure to inhibit glucose production in liver, which will cause high fasting blood glucose level. There is failure of glucose uptake and glycogen formation in skeletal muscle. That will lead to high glucose after meal, that is postprandial. There will be failure to inhibit lipoprotein lipase in adipose tissue. This will increase the free fatty acids which are circulating, hence the insulin resistance is amplified. The next disease it causes is diabetes mellitus type 2. Insulin resistance and hyperinsulinemia are metabolic defects that play an important role in diabetes mellitus. As we have already seen, they increase fasting and postprandial glucose. Then hypertension. The Then hypertension. There is increased insulin, there is retention of sodium, which is followed by retention of fluids, which leads to increased blood volume. Due to increased blood volume, the body responds by releasing norepinephrine and smooth muscle proliferation, which in turn leads to hypertension. Coronary artery disease. Obesity is associated with hypertriglyceridemia and low HDL cholesterol, leading to atherosclerosis and affecting coronary arteries, leading to coronary heart disease. Non-alcoholic fatty liver disease. Usually fatty liver is reversible in the initial stages, but if obesity is not modified by lifestyle, this along with diabetes mellitus type 2 can cause fibrosis and in turn cirrhosis. Gallstones. It is 6 times more common in obese individuals. This occurs due to increase in total cholesterol level, increased cholesterol turnover, and increased biliary excretion in bile, which leads to cholesterol-rich gallstones. Next is Pickwickian syndrome. There is excessive sleepiness in night and day and can cause breath pause while sleeping called apnea. This is associated with polycythemia and right heart failure. Osteoarthritis. Increased adipose tissue can cause trauma to joints over the time, resulting in degenerative joint diseases. Pro-inflammatory state. Obesity results in pro-inflammatory state, which is evidenced by increased level of C-reactive protein. This can also contribute as an important risk factors to the diseases that we have already discussed. Then cancer. In obese men, the cancer of esophagus, thyroid, colon, and kidney are common, while in obese female, cancer of esophagus, gallbladder, endometrium, and kidney are more common. The mechanism by which obesity causes cancer are hyperinsulinemia, increased steroid hormones, reduce adiponectin from adipose tissue, and pro-inflammatory state. So how does hyperinsulinemia causes cancer? First, there is increased insulin level in the blood, which leads to increased free insulin-like growth factor 1, also called IGF-1, which then binds to its receptor IGFR1. This activates the RAS and PI3K AKT pathway, which causes mitosis and promotes growth of normal and cancerous cells. The steroid hormones regulate growth and differentiation in many organs, including breast and uterus. Obesity increases androgen production in ovary and adrenals. It also inhibits production of sex hormone binding globulin in liver. As a result, there is increased level of estrogen. Adiponectin suppresses cell proliferation and promotes apoptosis. But since in obesity adiponectin is decreased, anti-cancer actions are compromised and this leads to cancer formation. Pro-inflammatory state. Pro-inflammatory state in obesity is carcinogenic by itself. All these factors contribute to cancer and obesity-related problems. I hope you have understood this topic. If you have any doubts, you can write to us in comment section. Please like and subscribe. Till the next time, this is Dr. Bismay signing out.